in a swollen intumescent cataract, which pupil device to use and why? A 70-year-old man with pseudoexfoliation, moderately dilating pupil, the antechamber is shallow, the lens is swollen, and there is hardly any space in the peripheral antechamber. We need to take care of the pupil to dilate it mechanically using a pupil expansion device. The choice of pupil expansion devices I had to make. The two common ones which I use is the B-HEX device and the Gupta expansion device, and now in this special situation I would want to choose a B-HEX device consciously, simply because we don't have much space to manipulate. So I would prefer to have a very thin device, which the B-HEX is. My concern is when I'm trying to manipulate the pupil expansion device, there's always a risk of rupturing the anticapsule because it is swollen and convex, and there's every likelihood that during the manipulation of a thicker pupil expansion device, the chances of damaging the anticapsule are high, and that's the reason why I have chosen the B-HEX device in this case. Time to place the B-HEX device. Fill the chamber with OVD. This is the orientation of the notches which I prefer to have, and it is placed in the pupil. At this point, it's important for me to remind myself that during the maneuvering these notches onto the pupillary margin, there is always a risk of the anticapsule getting ruptured, so I need to be mindful of that. Slowly but surely, the B-HEX forceps is used to maneuver the notches onto the pupillary margin. The first two sets of notches are engaged, the hand is switched, the last pair of notches then gently engaged. So now we have a pupil dilatation of about 5 to 5.5 mm in size, and it should suffice for managing the nucleus.